Hello, I'm Maria and I'm from Mothers for Mothers. We're a peer support organisation that support women and their families through maternal mental health issues, and we've been doing this for almost 40 years now. Everyone who works or volunteers for Mothers has their own lived experience of a maternal mental health issue, so we understand the thoughts and feelings and what you're going through, and we're able to support you and walk with you as you make your journey back to recovery. Women we support could be finding it hard to adjust to parenthood for the first time, or they could just be feeling lonely and isolated. They could be feeling anxious and depressed. They could have suffered from a birth trauma or have some past trauma in their life that's resurfaced during their pregnancy or after they've given birth. They may even have spent some time in the mother and baby unit. For some people, it might be the first time they've ever felt this way, and for other people, it can be that they've had a previous mental health issue which has become worse during their pregnancy or become worse after they've had their baby. If you feel this way, or you think you may be becoming poorly, please speak to your family and friends. Also speak to your GP, your midwife, your health visitor. Your healthcare professionals are all there and open at the moment to listen to you and to provide you with advice and to help you find the support that you need. For some women, medication can really help, and it's really good to get advice from your healthcare professionals about what medication is best for you. And if you are taking medication, please don't try and stop on your own. Get advice from your healthcare professional, speak to your GP. Also speak to your pharmacist to try and arrange to make sure that you're getting your prescriptions that you need on time. There are lots of organisations around at the moment that are offering support virtually, and you can obtain some virtual counselling via Zoom or other platforms. And there's also some other organisations with virtual support groups. At Mothers for Mothers, at the moment, we have our helpline, which is open Monday to Fridays, which you can call and just speak to one of our staff or volunteers who has a lived experience of a maternal mental health issue and talk through your thoughts and feelings and try and get some advice and some help and some signposting to other things which might help you. You can also speak to any of our peer support workers. They're doing extended phone calls and support calls, and we can arrange for you to have someone call you at the same time every week to talk to you and help you through this time. And we also have a peer support group on Zoom. Outside of the COVID-19 situation, our peer support groups take place in real life and we all meet together face to face. But at the moment, they're taking part on the Zoom platform, and you can join that and speak to other women and speak to our peer support workers on that. And there's lots of things you can try to do for yourself. Lots of people find trying to have a focus for the day really helps, but you shouldn't feel guilty if you do end up free-flowing and just responding to your own needs and your baby's needs. That's just as important. But do try and take your daily walk with your baby or your young children. Having the opportunity to get out in the fresh air and to have a walk around and to notice things around you is really, really important. And you can also try making notes about your baby or your child's development and keeping a journal of their time and sharing that with friends and family, which will help them keep connected to you and keep connected to what's going, particularly if you've got a very young baby at the moment and your friends and family aren't having the opportunity to see you both and spend time with you. I'm going to hand over to our peer support workers. Abby will talk to you a little bit more about this, and our other peer support worker, Rebecca, will talk to you about managing your feelings during COVID-19. But if you do need support from Mothers for Mothers, please do give us a call. We're open Monday to Fridays, 10 a.m. to 9 p.m. on 0117 935 9366, and you can speak to one of our support workers and we'll try and give you the best support we can during this time. We support women who are pregnant and who have just had a baby right up until the youngest child of the family goes to school. So please do contact us and we'll do our very best to support you. Thank you.
What is right for you? There's a lot of ideas and advice on social media, but this information can be very overwhelming. What you need to do is to work out what is right for you and what is right for your family. Self-care. Again, there's loads of suggestion on the social media for what you can do for your self-care. But what is important is don't let it become a chore. In other words, don't let it be difficult doing your self-care. What you need to work out is what is the right thing for you to do for your self-care and carve out the time to do it. in a day and a specific time so that you have the space for your self-care. Connection. Try to keep up with your connection. Family support, friends support. Just make sure that connection keep going. Don't give up on your connection. Don't let go. It's important that you keep your connection going.
I think almost everyone at this time is feeling an uptick in their levels of anxiety. Everyone is feeling an increase of pressure on their mental well-being. I think that is understandable within the situation that we find ourselves. We are dealing with an international crisis. We're dealing with a global pandemic, and for your standard member of the population, this is difficult. This is a hard time to live your life, and I think it is understandable to feel overwhelmed. The pandemic is bringing feelings of fear and worry for our own personal health, for the health of our families, particularly vulnerable members of our family. It's increasing concern over our financial situations, and through the necessity of self-isolation, it's leading to the loss of our all important connections with our support networks. Those connections that get us through day to day, and that is just a standard member of the population. I think once you introduce pregnancy, a newborn, early motherhood into the mix, you've got a potential for increasing that anxiety tenfold. It's even more to deal with. As pregnant women, we are in a vulnerable category. We've been put in a vulnerable category. We are facing, massive changes to healthcare policy, where appointments that would have been traditionally face to face are now being done over the phone. Appointments that you'd be attending with a partner or friends, or family. You're now going on your own. It's huge. You can't underestimate the impact of that. Of that distance from your healthcare provider, and how that can lead to anxiety. I think it's understandable to feel overwhelmed, and whether these feelings of anxiety are a new thing, or whether you've experienced these feelings before. Because if you've had an established condition, if you've experienced mental health challenges before, maybe you've got yourself a bit of a toolbox. Maybe you've got techniques that you can use to make you feel that a little bit better, to relieve the pressure. Whether it's physical techniques like breath control, yoga and mindfulness, or techniques that you've learnt during therapy sessions for CBT or ACT, where you're able to or been able to sift through your thoughts, to be able to step back and look at your thoughts and reduce your anxiety. It's something that you can use, but even then, I think even the best laid plans can be washed aside by extremes, such as that we're facing now. And I think that if these are new thoughts or fears, worries, the increase of feelings of loneliness and isolation, whether it's new to you or whether it reminds you of times past, it's definitely time to reach out. It's definitely the right thing to do to ask for help, whether it's from supportive members of your family, from your healthcare providers, or from organisations that are there to give you clear information, to give you reassurance, understanding, and encouragement. It's definitely the time to reach out and ask for help.